When your infant is very sick, waiting for answers can feel like a lifetime. A new law aims to get families a quicker diagnosis through increased access to rapid genetic testing. News 8's Eva Zamaris live at UConn Health in Farmington with a look at that new law. Eva.
Good evening to you, Darren. This did pass with bipartisan support. The hope is to help families waiting for answers.
Olivia was our daughter. She was born in 2022 with an ultra-rare genetic condition.
Ben King knows firsthand how difficult and devastating it can be to wait for answers when your child is critically ill and needs help.
Every test imaginable was ordered. Every specialist and subspecialist consulted on her.
Through genetic testing, Ben and his family learned Olivia had an extremely rare, extremely severe brain disease with no cure. She passed away at 4 months old.
If she knew nothing else, she knows that she was loved.
Together, they fought to make broad genetic testing accessible to everyone. And on Thursday, he joined a bipartisan group of Connecticut lawmakers who celebrated a new law that aims to do that.
For some families in the state of Connecticut, they had access to the whole genome sequencing. But for families who are on Medicaid in the state of Connecticut, they did not.
This law, which went into effect on July 1st, requires medically necessary Medicaid coverage for rapid whole genome sequencing for certain critically ill infants.
And what this testing does is zoom in on our genes and look to see if there's any spelling mistakes or errors, right? So instead of other tests, which kind of pick out a few different genes to look at and say, is there a spelling error here or not? This is going to look at it all.
We've learned this testing delivers an accurate diagnosis within a few short days, helping families and medical teams make a plan and decisions when seconds count.
Approximately 25 to 30 million people in the U.S. have one of the 7,000 rare diseases, which are responsible for 25% of pediatric hospitalizations.
These lawmakers added the hope with this law is to expand access and shatter boundaries to care.
When Medicaid can do it, then hopefully all the other insurances can follow as well.
Let's go forth and do bigger and better things for our community.
For a closer look at this law, we have those details for you right on our News 8 website and app. Live in Farmington tonight, I'm Eva Zamaris, News 8.